Hello, my name is Syed Shah. Today our group, the electronic calendar, is giving the presentation on the group research project. Our group research project is on functionalized graphene oxide for cancer treatment of promising nanomaterials. We are presenting the group research project to Dr. Samir Iqbal. He is Associate Professor in Electrical Engineering at University of Texas Western Medical Center, USA. This is the electronic calendar group. The first one is Arooma Aamir, then me, Syed Shah, and the third member is Maira Farman, and the last member is Habeel. I want to explain the outline layout of the presentation. I will first start with the background of the topics, then briefly introducing the topics from cancer to graphene oxide for cancer treatment. Then I highlighted some state-of-the-art approaches. Then next, Aamir will presenting the motivation and problem statement. Subsequently, Habeel will presenting a solution to proposed in literature with its limitations. Lastly, Maira Farman will presenting the solution with proposed by our group, and then she will concluding the presentations. So background, let's talk about some essential point why this research is necessary nowadays. There are more than 8 million people who died in a year worldwide. Before starting about the presentation, I'm briefly presenting the cancer. That's what is cancer and why this is so dangerous. Cancer is a disease caused when cells divided uncontrollably and spread into surrounding tissues. Cancer is caused by changes in DNA. These changes are also called DNA changes. Genetic changes that cause cancers can be inherited or rise from certain environmental factors like exposure, like viruses, smoking, cell dividing, dangerous chemical, ultraviolet radiation. So due to these genetic changes occur or this cause the cancer. So then how to detect them at earlier stages. So for diagnosis them. So there are different approaches to detect the cancer, like we are using the graphene oxide for cancer treatment. There are several disadvantages by using the graphene oxide in cancer treatment, like the graphene oxide is toxic and drug delivery. We need to make them non-toxic. So there are some existing technologies. Researchers from different institutes have given the proposed solution for cancer treatment. So there are several chips-based graphene oxide and carbon that can capture circulating tumor cells or all size and types, and can be do so with a greater sensitivity than existing technology. The first state-of-the-art approach is a liquid bispecific chip development. A new liquid bispecific chip development detects circulating tumor cells in 100% of blood samples from 1 to 4 breast cancer patients. So the chip could be used to detect tumors at the earliest stages vectored by the metastasis. In the second approach is liquid bispecific chips that detects metastatic cancer cells in a drop of a blood. This chip developed with additional images or other liquid bispecific devices, most of which use microfluidic to capture cancer cells, while the initial test with the chip have focused on the breast cancer. This could be have set up the detect a wide range of tumor device. The first approach, we talk about liquid bispecific chips development. It is the picture of that sensor, and the second one is the liquid bispecific cancer. It is the techniques to detect the cancer. And this is the main shape of that. And the third one is DOX NGO NG1 cancer combination treatment system. It is based on pH sensitive. It is being developed successfully. The result shows that DOX NGO PEG and 1 can be easily absorbed by tumor cells and collaborated directly and defected. So the next Arooma will presenting at point at presentations. Thank you for my side.
Assalamu alaikum. I'm Arooma Aamir. Thank you, Ahmed, for your part. So I'm going to explain the motivation and problem statement of our project. So let's start with motivation. Cancer is one of the major diseases which affects different parts of the human body and has caused around 8 million deaths worldwide. Initially, chemotherapy and traditional radiation therapy were the only techniques used for the treatment of cancer. The effect of these techniques is generally poor, and they have many limitations because of patient intolerance and high side effects. Due to this, it was very important to explore and find more safe and effective techniques for the treatment of cancer. For the past few years, nanomaterials have been extensively used for the treatment of cancer cells. Graphene oxide, a promising nanomaterial, has special biological and chemical characteristics due to which it has been widely used in the biomedical field. Graphene oxide is considered a better photothermal agent in comparison to carbon nanotubes and gold nanomaterials. This is due to its low cost, high efficiency, and miniature size. Graphene oxide also has ultra-high surface area and high photothermal conversion capability in near infrared wavelength region. All these properties make it an ideal, highly biocompatible material. Now let's go to the problem statement. So there is a great concern associated with the usage of reduced graphene oxide. It can get accumulated in the organs and has the potential to cause long or short-term toxicity. Shape, size, lateral dimension, number of layers, and impurities play very major roles in the distribution and toxicity. Due to this, the overall effect can be changed if we change the size or shape of graphene. And different processes in the preparation of graphene oxide may also cause toxicity. However, appropriate surface functionalization of graphene oxide can lower its toxic effect and make it more stable. So that's all from my side. Now I would like to invite Habeel to continue the presentation.
Thanks, Arooma. I will be presenting solution to the problem of toxicity. So in this GRP, we have proposed two solutions. One solution is proposed in the literature and its limitations, which will be covered by me. And the other is the solution proposed by electronic calendars, which will be covered by Maira after my part. So what is the solution of this problem of toxicity? So appropriate functionalization of graphene oxide with different materials to reduce toxicity. So frequently it is functionalized with polymers. So we have graphene oxide nanoparticles, we surface functionalize it, and we have surface functionalized graphene oxide. So we use drug or photosensitizer loaded graphene oxide nanoparticles. We use drugs to load them, and then they have multiple applications in photothermal therapy, targeted drug delivery, etc. So the solubility of GO in water is improved. The high accuracy in photothermal therapy is achieved without damaging the healthy cells. So normally it is functionalized with different polymers, which include the chitosan functionalized GO nanoparticles. Chitosan is a mucoadhesive, non-toxic, biocompatible, and biodegradable material. It improves the strength and stability. Solubility of GO sheets is improved. The greater loading efficiency and dispersibility is achieved. So if you look at the table below, it shows the drug loading efficiency and drug release efficiency of different GO CS nanocomposites. The drug loading efficiency varies from 5.3% to 65% depending upon the nanocomposite which is used. So the other material which is used for functionalization of graphene oxide is PEG. Covalent or non-covalent methods are used for functionalization. The coating of PEG results in protection from degradation. Circulating time of nanoparticles in bloodstream is increased. It is declared as PEG is declared as the safe material. It has low toxicity, high biocompatibility, and excellent stability. If you look at the picture on the right, you can see that we have graphene oxide, and then after functionalization, we get PEG functionalized graphene oxide, which has high solubility, high stability, increased antibacterial potency, cell attachment, growth, etc., and have multiple applications in tissue engineering and so on. And the table below also shows the drug loading efficiency and drug release efficiency of different GO PEG nanocomposites. And you can see that for one composite, it do have the drug loading efficiency of 100%. So there are several other materials which can be used to functionalize graphene oxide. They include HA, PVA, PA, PEI, and DEX. The usage of these materials is dependent upon the application. They are used to reduce toxicity, by increase biocompatibility, increase the stability. The cost effectiveness is achieved for HA functionalization with graphene oxide, and HA also results in high aqueous solubility and satisfactory drug ratio, which is 42.9%. So these materials, if you look at the picture on the right, you can see that graphene oxide functionalization with polymer result in, and the resultant polymer, the graphene oxide nanocomposite. They do have several limitations to that. For some nanocomposites, it have an increased cost due to complex experimental setup. We have large molecule size, low biodegradability, low solubility at pH is equal to 7.4 for PVA, low dispersion stability, and low biocompatibility for PVA. So this is all from my side, and the presentation will be continued by Maira. Thank you very much.
Hi, I am Maira Farman, and I'm going to represent solution proposed by electronic blenders. Graphene-based quantum dots can be utilized instead of graphene oxide because of excellent properties like chemical and physical properties, reduced toxicity, high water dispersibility, high surface to volume ratio. Graphene-based quantum dots can provide higher receptor binding affinity and improve cell uptake ability in comparison with polyethylene glycol. Graphene-based quantum dots, due to low toxicity and flexible functionalization of surface, can be functionalized with different materials for applications in drug delivery, cancer therapy, and bioimaging. So instead of graphene oxide, it is proposed to use quantum dots based on graphene and functionalize them with appropriate materials to reduce toxicity for cancer therapy. Another solution for reduction of toxicity of graphene oxide is to use new methods for synthesis other than prevailing. Normally, graphite is placed in concentrated acid in the presence of oxidizing agent for synthesis of graphene oxide. Humer's method is most widely used for synthesis of graphene oxide, but it produces toxic byproducts. There are several methods that can be used for synthesis which are less hazardous and are more efficient, like modified Humer's method, Tour method, etc. These methods are cheap, non-toxic, and environmental friendly. Lastly, graphene oxide, being a biocompatible nanoparticle, can also be used in a technique called magnetic fluid hyperthermia. It is considered way better than traditional hyperthermia therapy. And this method, with the help of magnetic fluid, temperature can be controlled by the velocity and size of nanoparticles inside the body. Other than this, the process of magnetic fluid hyperthermia has a lot of advantages as compared to other laser-based hyperthermia. This includes high accumulation of magnetic nanoparticles through magnetic targeting strategies in the tumor cells. There is also higher penetration ability of magnetic fields in our tissues. This therapy has been largely investigated due to its limited side effects and high efficiency. But these solutions have some limitations, as these solutions are not experimentally validated and are costly. Here's the conclusion of our presentation. Graphene oxide, due to its functionalization with polymers and other materials, is finding its potential application in drug delivery, cancer treatment, and tissue engineering. Despite its advantages, the toxicity and accumulation of graphene oxide in organs raise concerns, and research is being conducted to address these concerns. We have explored solutions given in literature for dealing with toxicity of graphene oxide functionalized with polymers. The limitations of solutions explored are also stated. Finally, we are proposed theoretical solutions for dealing with this problem of toxicity. In future, these solutions should be explored further and validated from lab experiments, as we weren't able to validate them due to unavailability of labs. Thank you for being such a wonderful audience.